Coming up on today's show, we are bringing you your weekly COVID-19 update. We know you've been missing it. We are talking all things COVID-19 and your mental health. Hello, darlings, and welcome to Wake Up Well, but this is your weekly COVID-19 update. I am your host, Portia Scott, but listen, I am not by myself. I have my two co-hosts, Dr. Donovan, Christie, and mental health professional Martinez, Marty Sellers. I am excited to be back. This is going to be an incredible show. So I want you to share this broadcast, have some watch parties. Listen, we need to know what's going on. We thought that we could pull back a little bit, but we see there's an uptick in cases. There's questions. School is coming back in the fall. What do we do? And we have your answers. So thank you, darling, so much for joining. Val, thank you so much for joining, darling. I know my husband's on. Thank you so much for joining, darling. You guys come on in. We are super excited to be back and to have you. As always, we want to know, where are you watching from? So make sure in the comments, you let us know where you're watching from. We know we have Atlanta usually in the house, Connecticut, LA. We are all over. So let us know where you are watching from, my friends. The next thing is, what are you grateful for? What are you grateful for? We all have something that we can absolutely be grateful for. I am grateful for my two co-hosts. Let me tell you, this is an incredible show, not because I host it, but because of the people that come on and share their expertise. So this is why you need to share. Listen, you get a doctor's point of view for free. You also get some mental health care for free. And so I am so grateful for the two guys that join me. I'm grateful for all of our special guests that come on. Hey, Ray, thank you so much for joining, darling. So listen, I'm going to bring them in. But as I'm bringing them in, type in the comments what you are grateful for. Another thing, I always do this on the daily show. What we do is when someone says something that speaks to you, whether it's me, whether it's a co-host, whether it's someone in the comments, we always say, hello, darling. And so that is our way of saying, I hear you. I get it. Make sure you come with your questions. Hey, Zeta, thank you so much for joining, darling. Hello. She is coming in from Texas, where the amount of Rona cases has increased, and we're going to talk about that. So I want to bring on, hello, darling. Hi, Deja. I want to bring on my co-hosts. I know they are ready. It's like they've been in the ring. They've been off for a week because we celebrated Father's Day, and they are ready. So my first co-host is going to be Dr. Donovan, Christie.
Hey, how's everybody? How's everybody? We had a week off there, and you see what happens when you take a week off.
I know. We took
Nothing
one.
Follows the plan, it's like, okay, well, you think you're out of the woods, huh?
It's so funny because we did the men's health. We took the week off, and it seems like they were like, oh, the weekly COVID-19 is taking a week off. I'm going to show them. So, Doc, thank you so much. I know you just got a Peloton run in. How are you feeling?
Oh, I'm feeling great. I'm feeling good. One of the things that I always tell my patients is that to improve your immune system, because right now I'm telling you, the way it's looking with over 31 states having this incline, this increase, dramatic increase in some cases, you really need to do everything to yourself to make sure that your immune system is up to par. And exercise, it should be like medicine. It shouldn't be something that you're drab about. You should say, okay, I'm going to get my daily dose of medicine. And that's how you should do it. You really should.
Absolutely. I love it, Doc. I love it. So I'm going to bring to the stage Marty, and then I want to hear what you guys are grateful for. So in the comments, please let us know. Doc practices what he preaches, because I think he just did 21 miles. Marty does the same as well. I get to talk to him and call him and be like, Marty, today is not a good day. So,
Right.
Marty, thank you so much for joining. How are you?
I am doing amazingly well. Good to see everyone. That week off took us all by surprise. I'm like, I got something I should be doing, but it's good to be here today.
I know.
Excellent. So,
How's
you
it going,
guys,
Marty?
I'm
I
doing
said
well, Doc.
I was so grateful for you too, but I want to go ahead and Doc, let us know, what are you grateful for?
Well, yeah, for this week, if I reflect on my week, I'm very grateful for my church home. I'm grateful to be able to be a part of the praise team at my church. I'm grateful for our pastors. I'm just grateful for this day that, I can go in there and just feel loved, appreciated, and to praise the Lord because, we're not just here out of happenstance. We have a purpose. And so to go in once a week and to just kind of solidify those feelings it's really a nice place to be. So, Pastor Scott, heal you up, sir.
I love it. And Doc, what church do you go to?
Let's see.
Maybe Christ
Culture
Culture.
in Tucker, Georgia.
We love it. Marty, what are you grateful for, sir?
I'm grateful for that everyone in my family is alive, healthy, doing well. But more important, today is my mother's birthday. So I'm grateful that my mother's living with me. She's alive, she's healthy. And today is she would kill me if I told her how old she is. But we're just grateful for that she's here. She's alive. My family's here today. And we're just having a great day today.
Awesome. I love it. I love it. Happy birthday, Ma. Oh, my goodness. So I love it. Val says she's grateful and thankful for safe travels. Yes, she's been away. Magaline said exercise as a daily dose of medicine. Okay, got it. Yes. Deja says she's grateful that her state, New Jersey, they flattened the curve and things are reopening. So I think it's time to jump right in. She kind of started us off.
Right.
There's some states that are flattening, Doc, but there's some states that are not. And I think, it was so funny as I was hearing the reports and kind of looking at everything and just thinking about what is going on. And how did we get here, right? And so I think there's so many questions, Marty, even for you around mental health and what this looks like. And so I just want to jump in, Doc. And so give us, what are the latest statistics? We always go over this, right? Because I don't watch the ticker anymore, but I think it's important to just look at what are the statistics, the cases, deaths, we usually do worldwide, and then like US and kind of breaking that down a little bit. I think we're at, is it 10 million?
Well, let's just look at the U.S. because I think that's where you have a lot of stuff going on, and in the U.S. we have 2.5 million cases, and we've had over 125,000 people have died from this pandemic. So we are definitely. This is very, very impactful. If you just look back from February until now, the end of June, we had 125,000 people that were pretty much, they were alive, going about their business, and it's pretty drastic that this has happened so rapidly in this 4-month span, and at the end of May, you started to see everything trending down because we really peaked in April. And then it started to come down. But as of June 1st, you saw a small little uptick. And then, this last 2 weeks has been major increases in ever since we left. It's just been soaring again to the fact where June 1st, we had, say, 14,000 new cases. Now we have 44,000. So you're looking at about, 4 times as much as it was in the beginning of June. So it's definitely, we've done some things that's caused it to come back.
Mm-hmm. So, Doc, let us know, what are some of those things, right? I think when we all started kind of opening up, we knew that, we'd see an uptick. And just from your professional sight, did you think the uptick would be like this, or?
Well, I think that, first we had Memorial Day weekend, and, everybody had cabin fever. So I think they thought that, everything is coming down. We had a couple of weeks, 3 weeks or so of everything trending downward. So people were predicting, well, we could just go out and go to the beach and do a lot of things without actually wearing masks and socializing, going to bars and hanging out, and that obviously had an impact. But I think where you see the biggest impact is after the police brutality killings, and the many states that had protesters, and a lot of these protesters, they may have had masks, but some of them were tear gassed, some of them were beaten with clubs, and it's a bad situation. But people needed to protest to stop that ridiculous behavior that's been going on for far too long. And I think when everybody came out, Portia, it essentially that took precedence over this pandemic, and people became much more fearless about going out and mingling and organizing, and that's what you're seeing right now. Just we had 3 weeks of protests, 3 weeks of protests. People were out doing what they thought is important, what they think is important.
Absolutely. I think too, you kind of see even when they started opening up everything, and started opening up, especially, here in Georgia was one of the first states to open up, and you go out still, and people are not social distancing. They're not wearing masks. And so they're just not following those protocols that are, they seem simple to me. I think sometimes we get confused because we feel like the protocols are political statements, and they're not. It's health statements. And so I'm going to jump to something I had later on, Doc, that we talked about was like, there's this thing that masks are not safe. If masks weren't safe, you wouldn't have worn them before this, right? Like when you go in to do different procedures. So what is this thing about masks not being safe? Are masks safe?
Well, if you're talking about, are they safe to wear? Yes, absolutely. They're safe to wear. There are some people that have low lung capacities. Let's just say that, if they're smokers, if they have asthma, if they have congestive heart failure, their lungs are filled up, with fluid halfway or whatever, they're going to have more difficulty wearing a mask because they do need to get oxygen. If you're overweight and you puff and puff when you go up a flight of stairs, that kind of stuff. So I know a lot of people will wear a mask and they'll put the mask below their mouth so they can breathe from the air, but that's not an effective use of a mask. Even if it's a cloth mask, it's better than nothing, because you can't get an N95 or KN95 just randomly. So, but masks are definitely, it's been shown that it reduces the transmission by about 90%. And you're not only protecting yourself, but you're protecting the other person. So it's kind of a selfish behavior not wearing a mask when you're in public, because we don't know what you have and you don't know what they have. So if everybody wears the mask, it's definitely, you're protecting each other.
Yeah.
But Portia, can I jump in? I think, Doc, would you agree that, especially with these cloth masks or the ones that we, that we need to also wash them, because so many people are using them constantly themselves? Because, and please correct me if I'm wrong, they're talking about how lung infections and some of these other things have increased because we're not sterilizing our own masks enough by washing them or disposing of them and getting some new updated disposable ones. So we'll use the same mask for 2, 3, 4 weeks at a time instead of sterilizing, cleaning it, disinfecting it, and that type of thing, which seems to me like it would be a problem, health problem, an issue as well.
Right, I agree, Marty. Yeah, you have to clean your mask. I mean, in the hospital, you can only wear a mask for a week. They change them out every week, those N95s. But the cloth masks, you can wash those every other day.
Yes.
it's that important because it's just personal hygiene as well.
Yes.
Right.
So,
Marty, you bring up a really good point. And I hadn't heard about like the increase in lungs, but just about making sure that we're just taking those steps to sanitize these things.
Yes.
You know, if you're wearing a cloth mask, wash it. I literally was just talking about that because I wear makeup, you know, so when I wear my mask, when I bring my mask off, it's full of makeup. So, you know, throw it in the wash, take care of it. They dry very quickly because they're very small. And so just making sure we have those habits in place. And so, you know, Marty, one of the things with the uptick in cases, you know, it felt like we had Corona. We had everything happen with George Floyd and just the racial
Yes.
injustice. We were trying to navigate that. And even though all of that is still going on, it's like Corona is back, you know,
Right.
even though we knew it was a thing, but now with the uptick, now you're hearing the deaths and the cases. Like, how do we maintain our sanity of feeling like, will we ever get out of all of this? Or, you know, at least at a point where we can manage it effectively mentally.
Right. That's a great statement there. So many things have been happening, and it's almost like it was the perfect storm for all of this to happen. And what I'm seeing again is even an increase on people who are calling me because, like you shared, there is this resurgence of fear that has come about as well. And what I say it this way, what I kind of have enjoyed and loved that more Black men are finally speaking out about their mental health desires and their mental health needs. I have had more Black men call me in the past 5 weeks that I have in probably the past 4 years combined. And that is a huge statement. Till I'm now referring them out because my caseload is so full. And so we're processing that. So I think we have to be wise in all we do. And later on, I'll definitely share with you my acronym that I use for wise in that. But we have to be wise. We have to know what we are capable of maintaining. And I go back to what Doc says. Doc, you've changed how I even do therapy with that in those three main elements of making sure that we're eating healthy, we're getting the exercise, and we're definitely meditating and making sure that we are staying grounded. And when things are out of our control, we have to take control over those things that we can take control over and then mitigate through the rest of that.
That's right. That's right. Doc, you know, just kind of going back to the states, what are kind of those five big states, you know, that are kind of seeing those increase? I want to read this really quickly because I saw it in like the Miami Herald, and they were saying that Florida added another 8,530 confirmed cases. Miami-Dade hit single day high. That was actually today. And I think they were talking about yesterday, but that they've seen a single day high. You know, and so I know Florida is one of the big states. My sister's
right.
in Texas. That's one of the big ones. And so,
hmm So, you have the city. New York has been the state, and New Jersey number one and number two in terms of the amount of cases and the amount of deaths. New
Wow.
York has had over almost 400,000 cases, and over 30,000 people in that state have died. And New Jersey, 173,000 cases, with almost 15,000 people have died. So if you just in that northeast area, that's where I grew up. We're talking 45,000 people have died over the past 4 months, or 3 4 months. But so the good news is that when you look at the upswing, because remember New York now, they didn't open up very quickly. They're actually not opened up yet. My son, who lives in Harlem with his wife and two kids, they came down at that right before the peak of that pandemic, and they've been staying with us for the past couple of months, and they're not allowed to go back to work yet. So I know that New York is still pretty much on lockdown, to say the least. But so the states that are having a really bad time are the states that like first of all California,
mm-hmm.
Texas, Florida, Arizona, South Carolina,
Hmm.
and Louisiana. Those are the top. And in the last 14 days, they've just had a tremendous amount of cases.
Yes.
It's just, I mean, the peak has just gone up, and it keeps going up. So, I think they're going to have to shut down those states again for at least another month to be able to stymie this increase or this peak that you're seeing going on again. Because now I saw my son showed me a cartoon where initially the cases were down here and then they went up here, right?
Mhm.
So and now since it went down and it's gone back up, they're saying, oh, okay, from here to here we've flattened the curve.
Right.
I had to laugh at that because it's not funny, but essentially what we've done, we've gone from one peak
One-
back
To
to another.
another peak. Yeah. So, Doc, I have a great question about that just because from that, I think one of your patients, Doc, said, "Hey, Dr. Donovan Christie, Tanisha Prater or Prater."
Prater, yeah. Hey, Tanisha, how are you doing? Good.
So my cousin Deja is on. She's in New Jersey, that New Jersey area. Absolutely devastating. Just what New York saw,
Mhm.
and learning from New York because they're decreasing in their cases and things like that. But I mean, they took a massive, massive hit,
Yeah.
at the beginning. And so you did say something about these states should quarantine again. And so when
Yeah.
you say that, is it kind of like
It's
locking
the
down again?
right. It's really the only effective mechanism of preventing the
Mhm.
spread. Is this isolation. You have to kind of keep people sheltered in, at least with some strictness to it.
Mhm.
And that's why you see in the United States why we're peaking again, whereas the other countries are not peaking as much as we are. We have a lot more freedom, and
Right.
people will fight. You saw what happened in Virginia, where a bunch of folks went to the Capitol there armed with weapons because the governor didn't want to open up the state, and they were basically saying we have a right to die. We should be able to
Right.
Right.
we should be able to go out there and do what we want to do, you know, not looking at the science and not looking at the fact that this is an infectious disease. It's a communicable disease, and we do need to have the right precautions.
Absolutely. Paula's in Connecticut, and I did hear that in that Northeast corridor, New York, Connecticut, New Jersey, that if you travel there, you have to quarantine. However, that's hard to do or to be able to, what does that look like, right? Like, how do you stop people? Are you stopping people as they're coming into Connecticut and stuff? So how they execute that would be something I would love to see, but I know that they are saying it. So maybe that is if you come, I know at the beginning when all this stuff was going on and people were trying to migrate from New York, other places, that if you had a New York license plate, they were like, no, they were stopping it, which is
Wow.
true that, we just read that the EU, when they open back up, that there may be a ban for people coming in. Of course, you can do that easier in when they're coming in on airplanes, but just people
Mhm.
driving back and forth. So I would like to see how they're going to manage that. But that was one thing, was like, how are these other countries able to keep that disease under wrap or the virus? And here we are peaking again because we want to
Well, I
have our
think I
way.
think it has to do, with leadership, and
Mm.
it's if you're going to leave all the states up to making their own decision, I
Yeah,
think you're going to have 52 different decisions
right.
versus having a uniform
Right.
process of how we're going to contain this disease, and we're not getting that anymore.
Right. And we're seeing it even happening from county to county because now I live right outside the neighboring county to Los Angeles County. So this weekend, they just put the requirement yet again for us to put masks back on because 2 weekends ago it was optional. But I've always worn mine. But now back again, I thank God for like a Costco who's been consistent across the board. They're like, in order to enter here, where you got to put on a mask. And in one of the stores, they were even taking people's temperatures with that. But we're even not consistent as it pertains to here, at least here in California, from county to county in that. And then even in certain cities, their rules are more stringent than other cities. And that makes it very confusing. I think that's part of the psychological problem we're having as well.
Absolutely.
As everyone has been just making their own rules with it as well. So it makes it very difficult to find the consistency in there in order to collectively combat this complicated problem.
Absolutely.
Exactly.
Deja said it's hard to understand people who aren't willing to make sacrifices for a brief period of time. And I said this earlier, I'm going to say it again. I stick to it that I don't know how coronavirus has become political, but it is. And so you almost have the people who say, oh, if you're wearing a mask, then you're this, or if you're not wearing a mask, then you're that. And so I think if we, like Doc said, if we hone in on the science of what's happening, look at the data, right? Data itself doesn't lie, maybe the interpretations, but data doesn't lie. We know that there has been a large amount of people that have died. But we've also seen countries that have been successful, that have not taken as much of a hit and we're able to, I guess, capitalize, for lack of a better word, with starting early with the quarantine, with all that stuff. So Jason, thanks, Jason. Thank you so much for joining, darling. He says safety first always and wisdom as the guide. Yes, absolutely. Love that. So Doc, one of the things I wanted to ask about was Sweden, right? And Sweden was one of those countries where they were saying, okay, we're not doing anything. We're going to try this herd immunity, right? Because you talked about it, 65% of the population kind of getting it, then we'll be immune to it. So were they successful? And is that something that
well, I was actually pulling for them. They were not successful. They had these peak death. Lots of them were older people in care homes because those people weren't protected. And if you're not going to protect the elderly from this disease, we know that their immune system is going to be somewhat suppressed because that's what happens with age. And then a lot of those people will have comorbidities, such as diabetes or some autoimmune deficiency, heart issues, kidney issues. So they didn't do a good job of protecting those people. So their death rate really soared high.
Wow.
The problem also is that, the younger people who have the disease, who get the disease, we know that young people typically don't die from this disease, right? They have the lowest death rate. But when they went back and they polled, they looked at their data, they found that less than 10% of the population from the people that were tested actually had antibodies. So these people, they're not getting the desired effect. You don't get herd immunity until 60 to 80% of the population has experienced the disease in an asymptomatic form or symptomatic form, doesn't really matter. So they're not protected right now. And so you get to say, well, Sweden did it this way. Other countries locked down totally. Is there a balance between, allowing the younger people to get it so you can get that herd immunity up,
right?
And or just locking down for everybody, and then you still have the risk of outbreaks because nobody's immunized, and not immunized, but nobody is immune from from it. So it's a tough situation. But they were not successful. They haven't been successful thus far. They just had some soaring death rates.
Wow. Yeah, I think that's the thing. I want to say, I may have heard it, so I don't want to quote anything, but I thought that there was a either a county or a state that was trying to go for that, like saying, okay, let's try this herd immunity. So, Doc, we kind of talked about it a little bit. And so, if I guess in a perfect world, how would we be able to execute herd immunity where the people with comorbidities, the people that are older, were safe, and it was the younger people that were kind of out there? Because I think too, there's a balance with the economy, right? And so your older people are more retired, your younger, depending on where they sit, they're running the economy, right? They're the consumers, they're the workers. So what would be kind of like a great balance between the two?
Yeah, that's a great question, because I think the best way would be to get the people who are older, let's say 65 and above. They need to quarantine. They basically don't need to come out. The people that have comorbidities, sick people with autoimmune disease, people with poorly controlled diabetes, people with altered immunity from kidney disease or heart disease or liver disease, those major organs. If those people were not exposed, and the younger, more vibrant people were exposed, and then they got the disease, had mild cases. Obviously, some it's going to have pretty severe cases, but very rarely. Like I mentioned before, 98% of people who are in good physical and mental shape survive this disease. I have right now, I'm managing about 10 people that's tested positive, and they're home. They're home. Am I there?
You're there, Doc.
Yeah, we had some issues there. So all I'm saying is that that's really the only way for herd immunity to work. If you have the masses getting immunized and having subclinical or asymptomatic cases, and then developing immunity, so they then, when they go around these other people with altered immune system, they're not going to give it to them.
Mm-hmm. Got it. Absolutely. So I think that's great. Marty, one of the things that I did want to ask is, all of this stuff is going on. And even as some of these states think about what Doc said, is that maybe quarantine is right. In Arizona, I think they said that their hospitals are almost at 80% capacity, Doc. And then I think in Texas, they're moving COVID patients to the children's hospital, and so they're going to have to make that decision of what that looks like. And so, Marty, what do you think? How long do you think the mental recovery is going to be? Or even after all this starts to settle down, what is that mental recovery going to look like? Not just with COVID, but COVID, and you got to add on all the racial stuff.
All the other,
unfortunately, we can't break it up separately because it's literally happening all at the same time. Yes.
Yes. To be totally honest, I think we're going to see the effects of this for some time, if not for some years, and that we're going to have to look at lots of different ways of addressing mental health and trying to break down all of those barriers. And what we're trying to do is partner with churches, organizations, nonprofits, trying to get the message out there as many ways as we can, going even to the universities and schools and talking to trainees about how they can get involved in spreading this message about mental health and how to cope with everything that's going on. I think in our Black and Brown communities, I'm glad that there is an awakening that is happening about mental health. But now that there is an awakening, how do we manage this awakening? How do we and I'll say it this way, I love it, herd immunity mentally for our communities as well, in this, because it's going to take healing, because we've ripped off the Band-Aid and now we've exposed it. Now what do we do? And it's going to take a collective effort. And so I'm loving that conversations and platforms like this, having these conversations with Dr. Christie and mental health, and doing a more integrative approach to medicine is going to be our way of doing it. And I think now is the time that we can make some drastic and some great changes in our approach to mental health and physical medicine.
Absolutely. I love how you said almost herd immunity to this mental health, right? So
Mhm.
some of us have had this bout or had to deal with something. And
Yes.
so hopefully people will get over it, before then or start to get healthier. And then you
Yes.
kind of have those people being able to help them. I think it's so important too, because when you think about, so one of the things is for this show, I was trying to find someone who had COVID, who had successfully, who was over COVID and things like that. And one of the questions or responses that I kept getting was, I will do it. I'm not ready yet because I'm not mentally prepared. And I think that as we've been talking about mental health, we've kind of been talking about the fear. I think I'm trying to look for it. Ray Dine said the fear, the anxiety and depression, almost about getting it, but not necessarily talking to people who have had it. And so how
W-
do they navigate that mentally? We have a lot of the physical things or medical things, but mentally, how are they
Yes.
Yeah.
able to navigate that?
One of my colleagues who's a black male therapist in the DC area, he has recovered from it. So even recovering as a therapist with COVID and all of that. And then I do have a pastor friend in the Dallas area who has also recovered from it as well. So I can definitely reach out to them for you, Portia, because I think they'd be amazing to bring on in the recovery process, because it is a process.
Mhm.
Let me,
Because you go ahead,
mhm.
Doc.
Yeah, I agree with you wholeheartedly, but I think what when Portia asked you about how long you think this is
Hmm.
to, and how many people are going to be affected, I just wanted to just when you look at past catastrophes and wars,
Hmm.
say this is a war, right? We're fighting
Right.
COVID. How many Americans you think died in Vietnam? 58,220. 58,000. The Korean War, 36,000.
Hmm.
World War II, 291,000.
Hmm.
And thus far, we have 125,000
Hmm.
people that's
That's
died.
good, Doc.
That's what I'm talking about is in 4 months, right? So
Yes.
when you look at
Right.
people are going to have PTSD,
See.
their loved ones have
Yes.
died. So they're going to be very much impacted. You're going to be busy, Marty,
We are already busy and
even busier.
busier. And
Yeah.
yes, and so many, because so many are impacted. If I can bring in even the black church, because it's something that pastors have not even experienced on this level before.
Right.
And we already know, like Doc was saying, the after effects of PTSD when you're in a war. Like, you're right, we're in a war.
Well,
We're in a race riot war. We're in a bio war with everything, and even in wartime, you at least have maybe some idea of when
Uh,
this war might
And
might might end.
that's true. You have some metrics of when this is
Yes.
particularly going to end, right? Even when you look at the war in Iraq, the war on
Yes.
terrorism, supposedly there was a metric, a day,
Hmm.
a time period more so than a
Right.
date that we felt like, oh, we would be able to go in and we would be able to win and do all these things within a
Hmm.
certain amount of time. What we found was it actually was longer. And
Yes.
that is the part I think that mentally, even physically, Doc, we can kind of think of when you think about like health challenges or when you think about these 30-day things to try to get your body together, you have those time periods in place. And so your mind almost says, oh, I can do this as
right.
long as I know when I'm going to have a reprieve or break or a cheat meal, And so with the war in Iraq, when it got extended, when it was like, this is going on far longer than we
Hmm.
expected, we thought we were going to have the victory a lot sooner.
Right.
Then what you do is you get soldiers that are fatigued. And
Hmm.
so then you start having mistakes and you start doing other things. And so even I think mentally, when your mind cannot
Yes.
grasp a end time or an end season, then it's kind of like, well, what do I do? How do I navigate that now mentally? Because I had a date or I thought, we thought that the summer oh, by the summer we'd be good. We thought that,
Right.
okay, we were even thinking November we may have a spike, and now it's
But it came
June
much
and we have
sooner.
a spike. So it's trying to navigate all of that mentally, as well as like, I was trying to make sure I'm getting my body together. I'm doing all this stuff, but I'm a little fatigued, not knowing, is this even working,
But that's when I think, Portia and Doc, we have to be extremely wise in everything we do. We
Mhm.
have to pace ourselves because this is not a sprint. This is a marathon.
Mhm.
And for those of us who have not ever I have not run a marathon, but it takes time, it takes discipline, it takes endurance. And I'm reminded the race is not given to the swift or the strong, but to those of us who endure to the end. We have to endure this. We have to
Right.
endure it physically, mentally, spiritually, psychologically, every lead we can think of. We have to do, and we have to keep ourselves encouraged and surrounded by encouragement the entire time.
Yeah. I want to make sure, Doc, you have something you wanted
Yeah,
to
well, I
say?
was just going to say, because even in my office, we'll see patients will come in there now, and they'll come in not wanting to wear a mask,
Hmm.
and they'll even hide their symptoms until you get in there. So we have our mask on, but it's almost like now we're going to have to get strict again.
Hmm.
To the point where you can't come back to the back office, or you can't even come into the waiting room because we're restricting how many people are going
Right.
in the waiting room at a time, and you have to basically wait in their car like they did, and just we call them in, one or two at a time, because it's just this. You mentioned marathon. This is the time that you have to be consistent. You have to be
Yes.
consistent in the preventative measures that are there, because we know.
Mhm.
We know what causes this disease. We know it's a virus. We know the virus is definitely contagious, and we just
Hmm.
have to do what we have to do to prevent the spread.
Yeah.
And
So, Doc,
healthcare workers in particular, I mean, I can
Yes.
tell you, let me give you some numbers on healthcare workers, because
yes, please
it's
do.
phenomenal. We have over 87,000 healthcare workers that's been infected with the
Wow.
coronavirus.
Wow.
87,000. And only 475 only have died. However, you could see that we are definitely at increased risk, because we're the ones, we can't say,
Right.
well, we're not going to
Right.
work because,
Hmm.
there's a risk. We can't
Hmm.
say we're going to just shelter in place. Then if we did that, then what would happen to the masses? We have to protect ourselves
Hmm.
when
Right.
we see
Right.
them. And that's what we have to do.
Yeah, it's almost like you enlisted in a war, but you had no idea that that's
Mhm.
what you were enlisting for. But Doc, I do want to ask this. Rena asked this question. I want to talk a little bit about vaccine and where we are, and are they testing? Are they even doing testing now? I asked that question because Rena says if the virus doesn't get under control in the next 3 months, what do you think the number of cases what do you think where will we be? So I think one is, what does the vaccination look like? And where do you think we will be in the next 3 months as we're seeing these upticks?
Well, I don't think that we're going to be ready for August or September for the kids to go back to school.
Mhm.
I thought that before, until this last couple of weeks with the uptick, and now we're almost at the same daily rates as we had in the peak of the pandemic. So I just don't think that we should be planning to sending our kids to school. I think you should plan not to send them to school, and make sure that your electronic, your Wi-Fi, your internet, everything is up to par, because we're going to have to educate the kids, and they have to learn somehow, through Zoom or whatever.
Mhm.
But in the next 3 months, let's say it peaks again in the next 2 weeks, and then it starts coming down again. It took literally 2 months to get back down, right?
Hmm.
So it's going by, let's say, July, August, that's going to be 2 months. September is going to be 3 months, but it's still, at this point, still swinging upward. It didn't peak yet. So I don't think that we're going to be safe until maybe November if we don't get a new strand that comes out.
Hmm.
And with the coronavirus, they've found out that it's not just that virus, that you can have co-infection with another virus. You
Oh,
can have
wow.
other viruses that are there. So sometimes we do a respiratory panel, which checks for the coronavirus, but it checks for adenovirus, it checks for the flu virus, it checks for
Hmm.
a variety of different viruses, 20 different viruses, because they could be also impacting the disease. And also pneumonia. There are patients
Yeah.
Right.
that may have the COVID, but they also have a bacterial pneumonia. We know that COVID causes a cytokine storm in the lung, which
Hmm.
creates this inflammation and this
Hmm.
respiratory distress syndrome in the lungs. So, what I recommend for all my patients that have tested positive and they're having mild symptoms, to prevent that cytokine storm, I recommend vitamin C, vitamin D, zinc. But I do recommend, if you're positive, not oral vitamin C. If you're positive and you don't want to get any sicker, you need to get intravenous vitamin C therapy, high doses, starting out at 30 grams to 50 grams to 75, 100 grams. That's how you basically prevent that outburst of inflammatory mediators that's going to flood your lungs and cause you to have respiratory distress syndrome.
Wow.
Yeah. Doc, you're always just a wealth of knowledge, and so
Yes.
one of the things you said was when people are coming in to get tested for COVID or have these respiratory issues, you're doing this panel. I'm just speaking for somebody who may be listening. Is that something that I can ask my physician, right? You may not be my primary care, but I'm
Hmm.
saying, oh, I'm having some respiratory issues. I am having some things going on. Am I not just being tested for COVID, but can you test me for everything else? Like, is that something that's done?
Yeah,
And
definitely. Yeah, I mean, I think as a primary care physician, they should have the capability of doing a nasal swab. It's the same swab test. It's not like you have to get tested 20 times. It's one swab. They do it, and then they send it off, and the lab is what tests for it. It's called a viral panel. So you can call your physician if you're sick and you're having respiratory issues. It's not just COVID. You want to see what else is out there. What else am I actually exposed to? What else could be contributing to this? Because some people will be sick and they want their COVID to be negative. I'm like, okay, yeah. And that's fine, because they know that most of the other viruses, except for flu, will most likely not kill you.
right,
But yeah,
absolutely.
you can definitely ask for a viral panel with your primary care doc, and they should be able to do it. If they don't have the swabs, those tests are run from LabCorp, they're run through Quest,
Hmm.
they're run through most major labs. And they must have some way of getting your blood or testing stuff when you
Right.
go to see them. Some doctors don't; they don't like to get involved with that. But the bottom line is that if you're going to come there, you have to be able to have the ability, the capability to test patients.
Absolutely. So I want to go to a couple of questions. Nicole, she is always asking questions. We love it. She loves the show. But she says, I agree that the conversations are extremely helpful. So she has a son that has traveled to Boston, 18 years old, and he's staying with his grandmother and great grandmother. So grandmother is over 65. She is and 92 years old. He's practicing social distancing, wearing a mask. What are some of the best practices that he can do? Is there anything else that he can do while he's there to make sure that they are safe?
Yeah, for sure. Remember that in Sweden, what happens is that these younger people went out and they may have had the disease, and they went around these frail elderly people, and they got sick, and that's why they had such high death rates. So the issue is that an 18-year-old, when he goes out, he just has to be careful to make sure
Hmm.
he wears his mask, he washes his hands, and he doesn't expose himself. That's about all he can do. And if he doesn't have to go out, then he shouldn't while he's there. But if he's there visiting, I'm sure he's going to want to do things, right? So
Right.
whatever he does, if he goes to a restaurant and they have every alternate tables, he wants to follow all those rules. and just that's about all he can do.
Yeah. Um,
But
Go
definitely,
ahead, Marty.
but also share and have the conversation so that grandma's not worried, so he's not worried,
Mhm.
and having these open and honest conversations so that they're making decisions together.
Good point.
That I
Yeah.
think makes a huge difference as
Right.
well. As my mother now stays with me and my son does. So
Mm,
Right.
we have these daily conversations. Okay,
Right. Where
where
you
have
going?
you been? Where are you
Right.
going? Who's all there? Because what we're seeing out here is now, Doc, and please correct me, is now we're seeing that 20 group that's now catching this COVID,
Mhm.
and
Yeah.
because of their exposure. Now we know a lot of it has to do because of the protests
Protest.
and those type of things as well. But now they're finding that they're not immune to it as well, and that they have to have conversations where they thought, we're okay, we don't need it, our immune system is strong, we're good. And now it's like, where
mhm,
have you been? Where are you going? Let's
Hmm.
go.
mhm.
Yeah.
Absolutely. Doc, thank you for that about the kids going to school. Do you think that's just overall? I mean, we're in Georgia, so of course I'm asking for me,
Hmm.
but I would assume that in the states where we see those upticks, I think it's 23 states in all that are seeing some type of uptick.
31 actually.
Wow.
31.
31.
Hmm.
Wow. So in those 31 states, your recommendation would be figure out figure out how to your kids
School
to go
them
to
at
school
home.
digitally. Yeah.
Right. Right.
In Gwinnett County, they sent something out and they asked the parents, they had did a survey, but I seen something where they came back and they're like, hey, you can decide whether to send your kids in or have them home. And so it's good to kind of hear your take on it because
Yeah.
Georgia is one of the states
Right.
that are upticking. It may not be
Right.
as large as
Right. It
Arizona
didn't
and
make
all
the
those,
top.
but
It didn't make the top five, but you're right. There's over 71,000 cases in Georgia, and
mhm,
this week, I mean, the last day on Saturday, we had over 1,900 new cases, and we've had over 2,700 deaths in Georgia. But when you break down the metropolitan Atlanta area, you have the Gwinnett County now is number one in terms
mhm,
of cases, which you know,
where I live.
I know. So there's 7,604 cases with 169 deaths. Fulton County is now number two. It used to be number one, 6,500 cases with 311 deaths. You can see a much higher death rate in Fulton County, however. And then DeKalb is 5,400 and Cobb is 4,500. So, but Georgia is definitely on the uptick, and we just have to make sure that we're practicing the proper personal protection to prevent this further spread.
Mhm.
No more protests for a couple of weeks.
I have two questions. Marty, I have one for you, but I
Uh-huh.
want to answer Deja's really quickly. She says,
Sure.
sorry if I missed this. How often do you recommend we get tested for those like her in Jersey with the states opening up or reopening and going out more now?
At least once a month. At
Once a
least
month.
once a month, you should get a COVID-19 test. Now, if you're symptomatic, you should get the swab test because you want to know if you have active disease. But if you are not symptomatic, you may have had a subclinical or asymptomatic case or a mild case. Then you want to do the antibody test because that's going to tell you if you're immune. It's going to tell you that you've been exposed, but you didn't get sick, and now you have the antibody.
Okay. Excellent. Thank you for that, Doc. Marty, Doc, is Juanita your sister?
Yes, she is.
Yeah, she said you get your smarts from her. Only a
Yeah.
sister would say that. So I was like, that's definitely a sister.
Yeah, and she's my younger sister, so I had
Oh,
to
wow.
look down to get all that knowledge.
Yeah, so she's
Older sister.
oh wow. So I'm the oldest. So hey, my sisters get all their smarts from me. But Maryland is climbing in numbers, she says. So Juanita's there in Maryland, and it sounds like they're climbing in. But that's that DMV area too, where you see that
Yeah.
DC, Maryland, Virginia area where a lot of protests were taking
Protests.
place too.
Yes.
Mhm. So Marty, one of the things I want to ask this as I want to make sure if anyone has questions, make sure you ask your questions. We want to make sure we ask your questions. We kind of bring questions on that we have either gathered through the week or seen different updates. But if you have any specific questions, make sure you ask them. Marty, one of the things I wanted to ask is, during all of this, a lot of people are sad or blue or, have those things that are going on. And I guess at what point should we go see someone, right? When is it just sad and blue, or at what point is it, that I say, okay, maybe I need to see someone or talk to somebody?
That's a great question. I say it this way. If you've had the thought, try and make the call. What does it hurt to say, hey, I'm thinking about this. I'm a little sad. Let me just call and inquire. Why not? Most places are giving free inquiries, or if you want to do that, you can ask the question. You can see that. Give it a call. Give it a try. Make the call. Yes, there are certain things that's blues in there, but why not make the call and just ask for yourself? It's better to have the answer. Have your question being answered. That's it, as opposed to just having this lingering in your mind, and then finding the right therapist that's right for you. Maybe you can just be a part of a support group. Maybe you need individual. Maybe you just need a check-in. I have some of my clients that just check in. They check in once a month, maybe 30 minutes for a session. You doing good? Okay, let's review something. So there's lots of different plans that you can even do in therapy. So it's not all heavy duty. It doesn't have to be, every week for 2 hours. It can be a group. It can be every other week. It can be once a month. You get to make that decision. But I think if you have the thought, make the call.
Yeah. And also, Marty, just because I just thought about Doc is saying and recommending, and I agree, Doc, 100% about the kids going back to school, right? Like in my mind, I was already like, listen, I had to pay private school for the last 2 months of school. And I was the teacher. So I was already like, I think they're going to stay home. I wasn't really comfortable, especially because, someone in my house is immunosuppressed. So we just want to make sure that he's safe. But Marty, one of my questions is, how young is, what's the minimum age to just maybe have your child talk to somebody if you see that, oh, they don't want to go out, or they're really, really scared about going out, or having these talks that, you're going to be back homeschooled again, and this is why, but it's going to be safe again. Like, how long is, what's the minimum age to have them just talk to somebody, just to check in, where they may not talk to us, they may talk to us, but it may be a little easier to talk to somebody else and articulate or have vocabulary for how they're feeling.
There are specialists now that are specialized in play therapy. It's something that I do. I'm not, I like doing it, but after play therapy, I need therapy myself. But play therapists are brilliant with getting those things out of our children that we normally would not do. One of the things I like doing, I have a 6-year-old client now, and a 6-year-old and an 8-year-old clients, both boys, and we do superhero therapy with them. I'm a huge superhero therapy. My favorite characters are Batman and Iron Man. Do not judge me on that. I am not narcissistic at all. But but we get to do those. So we get to create our own storylines and our own villains and our own superheroes with their own superpowers, and we get to pull those things out of them and have wonderful dialogue around that. So if they're having questions, or if you see something different in your child's behavior, something that, again, we said this a few times, but if you're seeing something different in their behavior or their normal patterns, that might be cause for concern. Have the conversation. And if you're feeling overwhelmed, again, call us. We will gladly talk to you about it. Or if we can't do it, we'll gladly also recommend to you maybe a play therapist who can pull those things out. But just like you're going through these emotions, our children are going through it as well. So give them time to breathe, allow them to express themselves, and continue to have the conversations. Talk about it.
Absolutely. Thanks, Marty. Doc, you know what? I don't want to go without asking this question because this question has come up a couple times. So Pamela says during the task force the other day, the report said that they could consider pooling for areas where there are outbreaks. What is pooling?
Pooling, to tell you the truth, I don't know exactly what that means.
Okay.
I don't truly understand what that means. So no, I don't. No, I'm not sure exactly what that would be.
What they were saying.
Yeah.
Absolutely. So I think one of the things that is good that we could take that back and kind of look at what they meant, because it may be a term that they're kind of using. And I think I want to say Pamela may be in the Northeast area.
I mean, I would think
she's
that
in
what they're
Texas.
they're
Okay.
just trying to isolate, certain people who have the disease and
Yes.
pretty much following them through it. I mean, that's the only thing that you could pool them together. But I
Yeah.
did want to say a bit about vaccines. That right now there are over 30 different vaccine trials with humans. So they're volunteers right now where they're giving people the coronavirus vaccinations, and then they're monitoring them. So now we're in this is stage. There's different stages of development. So this is kind of like the final stage. They're just going to check to see what type of side effects people are going to have. Is it effective? Are people going to be producing antibodies to this so that they can be immune?
Mm-hmm.
So it's looking pretty good. So I'm thinking that the FDA may be able to come out with something by let's say the fall. They
Yeah.
may approve something. It may be something where they say, you take it at your own risk. But
Right.
if you're mounting the response, that will definitely help to curtail this pandemic.
And then, Doc, while they're doing these tests, are they testing a wide range of subjects, right? So Caucasian subjects, Black subjects, just to see
Mhm.
how they interact with the vaccines, because sometimes there's and there's medicines or things like that where oftentimes African Americans or Blacks are not included in those case studies. And so when we take them, our reactions are sometimes a little bit different. So, but it sounds like they're doing a wide range of
Right.
trials.
They are.
Um,
They are.
yes, it's so funny. Nicole was asking to say, I was literally getting ready to ask that. Are the trials being done in Africa? So, everything on the internet, we know the internet, everything on the internet is not always true, but I have been seeing that it's going around that the first testing is starting in Africa. And obviously that is, that's a sore spot. It's something too that we're like, oh, well, you want to go take the vaccine to Africa to see if it works. So,
I
yeah,
wouldn't be surprised. Because poorer countries
are more, yeah.
are more likely, especially they usually pay volunteers.
Mhm.
So if they're going to go there and say, well, you try this vaccine, we'll give you $10, you may be able to get more people participating in it at that point. But they're doing trials in the US and they're doing trials in Britain. So I know that for a fact. So whether the other trials that they're doing is not being publicized.
Right. But you make a good point. That's what the thing is. And Nicole, no, it's funny because I was literally going there because I had seen it too. But I think, Doc, you make a good point that you are getting paid for this. So you go to underdeveloped countries where they're saying try this, and they'd much rather try a trial so that they can feed their families, which is a whole nother show, right? In itself, a whole nother show. I know we're getting ready to wrap up. Marty, you talked about WISE.
Yes.
Let us know what that acronym is for WISE and what that means, and how can that help us navigate what we're going through now?
I say it this way, being wise in everything we do about mental health. W definitely stands for working through your emotions and stressors. Work through those emotions and stressors as we're going through this, whether we're back on the uptick or not. Work through your own emotions and stressors. I stands for increase your awareness of your stressors. Make sure you know what are triggering you, what stresses you out in those type of situations. S stands for set your own personal priorities and goals. Just because, as we're saying, that we've opened up a state or opened up a county, listen, you know yourself better than anyone else. Don't fall into the pressures of that so that you're feeling pressure and making unwise decisions with that. And finally, E is this: evaluate and examine your own self-care. And as Doc always says, exercise. Do whatever you can, because as you exercise, eat healthier in that, and do your meditation, it's going to help keep those things lower for you so that you can make wise decisions about your own mental health and how to keep it under wraps. So that's my whole thing with WISE.
I love it. I love it. Doc, any final words before we go?
Well, I just think that, what I'm advising everyone to do is to kind of crank back up the way we were back in mid-May. Make sure you're wearing your personal protective equipment. Definitely healthcare workers, we have to do that as we see patients and take care of them. But for the folks out there, let's get these numbers back down again. It's going up in Georgia. This is where it is. But we know, I just mentioned 5 other states that really back to the peak pandemic numbers. And in those states, those people, they really need to decide what's going to happen. We have 125,000 people that's already passed from this disease. And, it can go up to 500,000 if we're not practicing the right isolation and the right techniques. So I would just urge you guys to do that.
Absolutely. Doc, thank you so much. Marty, I know we just got your WISE acronym, so thank you so much for that. Thank you guys, as always, for joining me. This is incredible. I cannot thank you enough for just all of your smarts, as Juanita says. Doc, we have to thank her because we understand that you got your smarts from her. So thank you, gentlemen. So very much for being on. I appreciate each and every one of you. So thank you so much.
It's been a pleasure as usual.
Oh, thank you. I want to say thank you to everyone that joins and listens in and comments and asks your questions. Thank you, thank you, thank you so much for being on. One of the things that I want to make sure that you guys are all aware of, we've been saying it on the daily show and kind of putting it out in communication, is that we need you to follow us on Portia Scott Media. So in the coming weeks, what's going to happen is we're going to transition from Facebook Live to YouTube. However, we're going to give it a couple weeks so that you're getting used to going to getting used to going to YouTube so that you can watch it. And so if anyone watches The Daily Show, you know that YouTube is a better platform for us. It gives us more expansion. It gives us more reach, the ability to scale the shows that we have. And so YouTube gives us that platform to be able to do that. So if you would go over to YouTube and follow us at Portia Scott Media, don't worry, we will not just cut you off. You guys are going to know the date when we fully transition. For now, what we're trying to do, and what you will see, is a lot of links to the show will go to YouTube so that we can point you over there. I want to be completely open so that you know that, how am I getting a link at Facebook that goes to YouTube? This is why. It gives us the opportunity for sponsorships. It gives us the opportunity to really highlight the shows that we have. We have some incredible news coming next week that I am super duper excited about. I always talk about impacting humanity, and we have partnered with an organization to be able to do that. And so we want to make sure that next week that you join us here so that you can hear all about that and that you can help us as well. We want to make sure to stay in touch with you. And the way that we do that is if you text the phrase "wake up" to 31996. That's "wake up" to 31996. So you know when this show is going live, as well as all the other shows that we have going on. I'm telling you, all the podcasts that we have. We have Mental Health Matters with Marty that releases every single Wednesday. Wake Up and Show Up with Portia Scott releases every Thursday. We have Candid Conversation Time. So we are doing amazing things, and I'm so excited, and I want you guys to be a part of that with us. So Thank you all so, so very much for joining. As always, we end every single show with this declaration. Waking up is automatic. Showing up is intentional. Today, I will show up.
Show up.
See you guys next week.